If you're one of the tens of millions of Americans suffering from acid reflux disease, you know the pain and discomfort of heartburn and the many other symptoms associated with the disease. But as Rod Starnes shows us in our cover story, chronic acid reflux could be a sign of an even more serious condition. The good news, Baptist Memorial Hospital Memphis has a new high-tech tool that can provide relief.
A cabinet full of antacid tablets. That's a familiar sight for many, like Steve Fogelsong. He's been dealing with acid reflux disease for decades.
I would get indigestion from almost anything that I ate. And sometimes it would be severe. It would be severe enough that I kept Rolaids or Tums on my person 24/7. Bottle by my bed, bottle in the truck, and package in my pocket.
Acid reflux occurs when stomach acid backs up into the esophagus. A serious problem, to be sure, but persistent reflux can actually cause severe damage.
One of the consequences of chronic acid irritation or reflux of acid from the stomach into the esophagus is a transformation of the lining cells of the esophagus, so they look more like intestinal lining cells, and that's called Barrett's esophagus. Once we identify that you have Barrett's, then we put you in a program to look periodically by endoscopy and to take biopsies of this Barrett's lining cells to look for the changes which we call dysplasia, which mark a very significant increased risk for the development of cancer.
Esophageal cancer is one of the fastest rising cancers in the country, with a survival rate of less than 10%. So early detection and treatment of Barrett's is critical. Unfortunately for patients with Barrett's, treatment hasn't always been easy.
Usually what the surgeon would do is take out a part of the esophagus and then pull the stomach up into the chest and reconnect the residual esophagus to the stomach. And it's a major operation, have to go through the chest. I mean, it's a big, big operation.
Not anymore. Say hello to Halo, one of the latest high-tech healthcare tools to hit the Mid-South. Now, surgeons have a non-invasive way to eliminate potentially cancerous cells in the esophagus.
What it does is take a balloon that's inflated into the lower part of the esophagus and using a computer-generated equipment, deliver just the right amount of radio frequency to develop heat to destroy, in a very controlled fashion, the very most superficial lining, less than 1 millimeter deep, so that you destroy the cells that line the esophagus, the Barrett's, without destroying the underlying normal structures.
Steve's endoscopic procedure at Baptist Memphis, the first like it in the region, was a success in more ways than one.
It's amazing to me because with this procedure, what we're trying to do is get rid of abnormal tissue. We really don't expect to change symptoms so much, but in his case, he's had complete eradication of some chest pain that he was having as a consequence of his reflux. And I think the reason for that is as his Barrett's was removed and being replaced with normal lining cells and also being on an intensive medical regimen, he's had complete resolution of all of his symptoms. It's even more than we expected, quite frankly.
Next morning, I had no pain when I ate, the very next morning. There is no pain whatsoever now. I don't even care if I have Rolaids with me. There's none in my truck. It's the difference between night and day. It's getting your life back, so to speak.
For Smart Medicine, I'm Rod Starnes.
Joining me now is gastroenterologist Dr. Edward Coutu, who we just saw in our cover story. And Dr. Coutu, thanks so much for joining us.
Glad to be here, Joe.
This Halo is an incredible piece of technology. How significant is this?
Yeah, it's major, although it's really very new to the Memphis area. There have been over 10,000 cases done in the world, and using the current technology, it's been shown to be able to ablate a Barrett's in 97% of folks. Now, unfortunately, not all of them have a single session like the patient we saw earlier, but an average of 2 to 2.1 sessions per patient, we can remove Barrett's completely.
Remarkable. Now, you could probably write a book in answer to this question, but who are the ideal candidates for this procedure?
There are several risk factors. First is chronic reflux. We usually talk about patients having heartburn or regurgitation 2 or more times per week for 5 or more years. The other 3 risk factors are being white, male, and over age 50. And the more of those factors you've got, the greater your risk. If you've got all 4, it's about a 20% risk. And so if you've got 1 or more of those, we're going to recommend something called a screening endoscopy to look to see if you have Barrett's. If you have Barrett's, then your doctor will recommend that you have periodic endoscopies for the course of your life, looking for cellular changes called dysplasia that was mentioned earlier on the segment, because dysplasia marks the highest risk to subsequently develop cancer. It's those patients with dysplasia that we used to recommend having surgery, having their esophagus taken out, that we now recommend Halo. However, having said that, it might be appropriate to consider treating all patients with Barrett's with Halo, because if we can get rid of the Barrett's, which we know we can do in 97% of folks, we can prevent them from having to have these surveillance endoscopies, and so over the course of time save healthcare dollars and a lot of patient inconvenience.
So what does the future hold, doctor, for the treatment of Barrett's esophagus and esophageal cancer?
Joe, there are two things I'd like to mention. One is the use of this Halo for early stage esophageal cancer. It's very preliminary, and we don't have a lot of patients who have undergone the treatment, but it looks like we can cure a lot of patients with esophageal cancer without ever having to go to surgery. Another thing I'd like to mention that's very exciting, there are a group of patients who have very severe reflux for whom medicines just don't work. And traditionally we've sent them to surgery, and over the years the surgery's gotten easier. They can do it laparoscopically now. But there's a new procedure called Esophyx that may allow us to do the surgery through the endoscope without the need for any incisions whatsoever. So hopefully we'll be able to give you an update on that in a few months.
Well, very promising. Thank you, doctor.
Yes, sir.